It's a presentation of 13ABC Action News. Now, your table is ready. Join 13ABC's Jeff Smith with the decision makers of Northwest Ohio and Southeast Michigan. This is the Roundtable.
We're talking about your health today on the Roundtable. Thank you so much for joining us here on this first full weekend of June. My name is Jeff Smith. For the next 20 minutes or so, we're going to be talking with some of our guests today who head up some of the area specialties on cancer and research, and not only research, but dealing with some of the patients out there. I want to bring your attention to a letter before we get to our guests, a letter that we received this week here at 13ABC talking about a little girl who wanted to go above and beyond the call of duty, specifically for those who are dealing with cancer. Jennifer Steger wrote this letter to us, and it reads, I'll go through it for you because it is a heartfelt letter. My daughter is a 13-year-old Jefferson Junior High student in the Washington Local District. Last week when I got home from work, she says, she told me to sit down. She had something very important to discuss with me. She told me that she had been on Pinterest and had come across a chemo care package. Then she had an idea. She wanted to create chemo care packages and donate them to area hospitals to pass out to patients going through chemo treatments. Then she told me she wanted to make 200 of them before going back to school in August, kind of a summer project for her. She said, I'm a single parent working a minimum wage job. Even though all of the items can be purchased at the local dollar store, there is no way I can afford to do all 200. Seeing as how she wants to brighten other people's day, I didn't want to shoot down the idea, so we created a group on Facebook called Abby's Helping Hands. I invited all of my friends and asked them to invite their friends. She talked to her uncle over the weekend and received her first donation. I also bought some items. She spent the weekend rolling up her penny collection and making handmade pictures to place in each bag. She started writing letters to her teachers to let them know what she's doing. Now, we need the help getting out the word and finding places that will help place her donation boxes. And she wrote, she ended the letter with, thank you so much for your help. Once again, we went out there and did some of the story and got some of the video of what she was putting in these care packages. But a heartfelt gesture from a 13-year-old here in the Toledo area, once again targeting something that we continue to do these stories on, a cause and an effect. The cause, stepping up and helping those who are battling this disease, and the effect is making a difference in their lives. I want to introduce my guest to you this afternoon. First, Jill Johnson. She is a family nurse practitioner, has been a board-certified nurse practitioner for the past 10 years, works with the Cancer Survivors Center, and has been in the nursing profession for over 30 years. Welcome to you today. Thank you so much for being here. Bonnie Graytop sitting next to her, an oncology certified social worker, has been with ProMedica Flower Hospital for 25 years. Coordinator for CHAMPS, which stands for Choosing Hope and Moving Past Sadness program for the last 7 years. Welcome to you.
Thank you.
And finally, Kelly Moore sitting next to me, a board-certified genetic counselor specializing in cancer genetics. And we're going to be talking to you about, in fact, we talked to you a couple of weeks ago when Angelina Jolie's story came out. We'll get more into that as the program goes on. Jill, I want to start out talking about where we are as far as not so much research, because I don't want to get into the nuts and bolts of that. It could be a longer show because there's a lot going on here locally. And there was just, in fact, this past weekend, a symposium in Chicago. All the Big Ten universities came together talking about how their direction is going as far as battling cancer and research is concerned, but dealing with patients. And that is the big move here in Northwest Ohio, is getting the word out to them of, I guess, the tools at the ready for them. Is that the case still?
Yes, actually there are approximately 13 million cancer survivors now in the United States, so that is becoming, survivor care is becoming quite prominent and an issue that everyone seems to be wanting to address, which is good. The recent conference that you're talking about was ASCO, and that is one of the large medical cancer conferences that takes place on an annual basis, where they update the treatment and research findings that people have been finding through clinical trials.
Right, not to leave out the University of Toledo and the research that's going on there, but obviously hitting the Associated Press wire, what the Big Ten, those big schools coming together and trying to, I guess, meld minds as far as the research that's concerned. as we talk about the survivors out there, and you know, I'm struck by CHAMPS, and we have done stories over the years as far as moving past sadness. Explain a little bit for 7 years putting that group together and what you are doing with it.
Right, so CHAMPS is for kids that have a loved one with cancer, someone that's very close to them. And so often the children's lives are kind of turned upside down. The parents are involved in, if it's the parent that has cancer or the grandparent, someone's involved with getting them back and forth to treatments. They're often not feeling well, and the routines in the family really change. And oftentimes the kids just sort of have to mosey along and cope, and the parents obviously do the best they can. But CHAMPS is an opportunity for them to come together with other children who are faced with the same sort of circumstances and be together. And we have a 3-day camp that's coming up in June, the 18th, 19th, and 20th.
Yes, great plug.
Right, and that'll be at the University of Toledo's Rec Center this year for the first time. And so we just try to plan activities that help them with some self-expression through art therapy, fun times.
It's not a diversion so much, because obviously you're not ignoring the issue, the elephant in the room, right?
Right, not at all.
Yeah.
Not at all. So we really, while it's not therapy, it is a chance for the kids to sort of express their concerns, what's going on in their family, and we give them techniques to help them cope through art, through exercise, yoga, music, all kinds of different things.
Yeah.
And
Jill, when you look, and Kelly, I'll get to you in just a second. Jill, when you look, you talk about a survivor network, and were we talking survivor network even 20 years ago? I mean, it seems to be the trend that there are more and more survivors. Is that a good read?
That's true. It's probably been less time than that. I would say probably within the last 10 years, maybe. The whole conversation regarding cancer survivorship has taken off. It used to be that when you got a diagnosis of cancer, that pretty much was, a death sentence.
Yeah.
And you need to be getting your affairs in order, and those were the conversations that took place between the physician and the patient. It's 6 months, a year, maybe if you're lucky 3 years. But it was pretty much, your life is coming to an end much quicker than you think it's, or thought it would be. It's time to actually get things in order.
Yeah.
No longer is that true. There are still some cancers that we aren't as lucky with, I guess, in terms of research that it will prolong survival. I think most of them, we can say we prolong survival, but there are a few of the cancers, excuse me, like lung and pancreatic and things like that, don't have as good of a prognosis still, or as good of a survivor rate as some of the other ones. But again, there are clinical trials going on all the time at all the universities, and clinical trials, patients are encouraged to participate in those, because that's how we discover new drugs and find out new treatments to get the point where they can be part of that survivor group.
Yeah, we're going to talk a little bit about some of those cancer rates, the incidence of cancer in Ohio and Michigan coming up in our second segment. Kelly, we talked a lot about the Angelina Jolie story a couple of weeks ago when she came out, and she was predetermined, yes, that she could be in that high-risk category, but how does that relate to our audience? And for those who didn't see the piece we did a couple of weeks ago, here locally, I mean, is it the old adage that, okay, I had a grandmother, or I had an aunt, or I had a mother who had cancer, that means I need to be doubly sure that I get checked out? Is that still the mindset somebody should have?
It is still the mindset that somebody should have, especially for those families where there are several family members with breast cancer or ovarian cancer, and women that are diagnosed, especially young women, that those other relatives should be extra vigilant in screening and talk to their physicians about genetic counseling and genetic testing to help see if that's something they may be appropriate for. I routinely talk to families about that, and if they meet criteria and it's something they're interested in, we can proceed with testing and see if, like Angelina Jolie, they're at significantly increased risk for breast cancer, ovarian cancer, and then modify their screening so that if cancer is going to develop, we catch it early, or offer other surgical options such as the ones Angelina Jolie chose.
Yeah, how can somebody be so sure that they need to get checked out, or that something's going to come back in the positive for them or in the negative? And how quickly, once they get checked out, do they find out?
Sure. So results typically take about 3 weeks or so from the time their blood is drawn until they would get those genetic test results from myself.
And they're pretty accurate.
They are. Genetic testing is very accurate. It is never 100%. So if it's a negative genetic test result, there's always that small question of maybe we missed something. However, it is getting better and better.
Yeah.
If it is a positive genetic test result that is actionable, women can take action to decrease their risk for breast cancer, whether that's additional breast MRIs, mammograms, or choosing some type of surgery that their physician and they are comfortable with. And it's not, again, all
scary,
families.
though, is
It
it
is
not?
scary. It is scary. It's a lot to think about, especially when these are families that typically have many individuals with cancer. Unfortunately, some of them may have passed away, and if it's a daughter or a niece, they may have seen that mother or that aunt pass away from the disease or fight very, very hard throughout that disease, and it brings a lot of emotional baggage, if you will, into genetic testing. So that's something we try and work through with the patient, with the family, and hopefully get past that. So if we do find something genetic that is increasing that risk in this very high risk family, then maybe they can feel a little bit empowered knowing what their risks are and how they can take action to decrease it.
One of the other things that we had talked about before we came out here was the insurance side of things. And Angelina Jolie, high profile person out there, her name bigger than life, but this isn't a test that necessarily has to bypass a number of people because they can't afford it. Is that correct?
You are correct. So out of pocket without insurance, yes, the testing is very, very expensive. However, many insurances cover, per their policy, a vast majority of the cost of the genetic testing. Now, is this for a young woman who's had one grandmother with breast cancer in her 70s? No, this test is not meant for that, and therefore insurance would not likely cover that. However, if it's a family that is appropriate for genetic testing as deemed by a physician or someone like myself, then insurance is very, very likely to cover it. Additionally, then they would cover the subsequent screenings recommendations that we would make, whether that's mammograms or breast MRIs, starting at young ages, or surgical options for that family.
Bonnie, she brought up just kind of the mindset that goes into this. How do you instill in patients or those who are questioning even getting genetic testing to keep the positive outlook, to continue to keep the positive outlook? Because it can get darn bleak sometimes.
Right. Well, you know, there's so much as far as support in the community through our cancer center, and so we utilize a lot of those resources. We find out where people's strengths are and really try to use those in facing some of these things, but it is very difficult. And so, you know, part of the assessment is sort of looking at the whole picture with that particular patient, and each one faces things in a different way. So we look for the strengths and try to build on those and offer the resources in the community and through our center that we can to help.
I'm especially interested too when you talk about CHAMPS and dealing with the youngsters, and do they find support? You always talk about adult support groups, but do the kids find strength in the other kids?
Right, absolutely. And just having somebody that you can...
They have to grow up pretty fast.
Right, another peer that you can relate to. And it's just really helpful to find out that you're not the only family that this has happened to. And so, you know, through the camp, through our monthly support groups, we have families that just keep coming back because they find it so helpful.
Okay. Stay right there. When we come back here on the Roundtable this afternoon, we're going to break down some of those specifics as far as the types of cancers we're talking about, how Ohio and Michigan deal with each of the number of incidents in these cases. Our conversation continues right after this.